thank you very much for having me on here, Verity. And yeah, after a few technical hiccups, we're here. Um, I'm a doctor. I'm a GP and menopause specialist, and I came into this, I guess, through being a GP. I was just seeing so many women who were having such a difficult time with issues related specifically to women's health problems, and they were just not getting the help that they needed or deserved. I then had some of my own personal experiences, which were really quite life changing. And I felt I just had to do better, and it really put a fire in my belly to want to help women. So I trained up as a women's health specialist and a menopause specialist with the British Menopause Society. I've taken my work back to the NHS and I've created in my own quite small surgery, like a women's health clinic and a menopause clinic. I'd also done that on a bigger scale and worked in a specialist referral clinic. But as everybody will know, the NHS is struggling with funding. So that specialist clinic was chopped, and that was like serving the York area and beyond, but that's no more. So together with my colleague, Dr Reid, who's a Jim, he's a prescribing lead, and he really felt he was seeing a lot of HRT shortage issues and prescribing errors. So we came together and created the York Clinic. And our goal at the York Clinic is to provide women with, individualised, personalised care so that they can have that time to really figure out what's best for them. And we're really passionate about providing ongoing support, but also helping you to then feed that back to the NHS, because that's, it's not right for every woman to be able to afford private care fully going.
Yeah.
So we will link in and try and give that expert advice and opinion. And what we're doing is within the grounds of what can be done on the NHS for the most part. There's caveats to that. Like there's some treatments that currently aren't available in the NHS. So we'll always talk that through with a woman so she's fully aware. So yeah, that's
amazing.
From. Yeah.
Amazing. Thank you so much. So I have I've kind of done the questions in categories so we can get through them. So the first one that I've just got 3 questions in. I think the majority of them, understanding menopause and the symptoms. So what are the biggest misconceptions that women have about menopause?
I think the misconceptions, and they're not just I guess in women, they're also in the medical community, and it's around the age you might go through or what you might start to have these symptoms. When I was taught initially as a GP, it was you're really looking for menopause in a woman around the age of 50, and younger than that, it's probably not that, and hence so many women will get dismissed. The truth is, perimenopause can start good 8 to 10 years before your final period. And the final period average in the UK is about 51 years of age. So we've got women easily entering their perimenopause in their early 40s. And if their actual menopause last period is going to be a bit sooner than that, it can be from their late 30s. So it's not unheard of at all for women now to be, it's hard because it's a time in life when it's usually quite a lot going on. There's a lot of plates being spun, and the symptoms are so variable, and they can almost gaslight you. They can come and go because that's the nature of hormones. You can have some stability and then they can flare and become more chaotic, and you don't know what to do. And it's hard sometimes to get the overview, like somebody who can really take that step back to look at the whole picture and give you some something of an opinion about what you're going through.
There, I think you hit the nail on the head with the massive list of symptoms, and this is why there's so much confusion around it. Because sometimes I think you can look at this list and think, no matter what age you're at, even much younger, and think, well, I could tick quite a few of those. And then that's why a lot of women are almost like self-diagnosing much younger and getting that worry and that stress and anxiety over it as well. That was brilliant. Thank you. So second question, what symptoms are considered normal and which ones should not be ignored?
So I guess normal symptoms. So what a lot of women, and again, what we're taught in medical school and beyond, is that hot flushes are the key symptom of menopause. But I would say that is easily not the most common symptom I see women presenting with in the first place. So I guess the question of what is normal is the symptom list is ever growing, and there's not really a standardized list anywhere. We know that we have hormone receptors for estrogen on like every organ in the body, so you can have skin changes, eye changes, body odor changes, your gut, your digestion can change. It's so far reaching that it's hard to say what's normal and what's not. It is important though, if you're noticing big changes, to get that opinion, because we could be missing something more, more untoward. There could be something at play. If a woman's bleeding's changing, if that bleeding is going towards a perimenopause, it's got a certain shift that I'd be looking for. Whereas if it's becoming exceptionally heavy, we've also then got to investigate and check we're not missing anything like fibroids, or I'm seeing a lot more women actually getting a diagnosis of adenomyosis, which is thickening of the womb lining, where the muscle layer really goes deeper into the musculature of the womb. And that's happening in perimenopause because everything starts to escalate at that time. So I think it raises a really important question of what is normal. There almost is no normal because every woman's going to experience this differently, but it is important to make sure we don't miss something else going on. So speaking to somebody that knows what they're talking about is really important.
Yeah, 100%, because like I said, the list of symptoms, but also one person's normal is someone else's normal. It's completely different. And that's why we can't just keep sticking to this list of things. And if we don't tick so many of them, then you're good. When actually those ones that you are ticking, yes, that could be a sign of perimenopause or menopause, but it also could be signs of other things that are going on. So is it more a case of just trying to be in tune with your own body and not ignoring anything, really?
Yeah, I think that's right. And women will put themselves at the bottom of the list. So they're often caregiving, they might have a young family or elderly parents, and their needs often will be the last thing that to look, they're sort of looking after so many different areas. I think women are naturally, that's the way life can pan out. But it is so important to think, right, no, I'm actually noticing this, and this, and I need to get seen and get an opinion. Blood, well, we can talk a bit about blood tests. I think you might be asking me that in a bit, Verity, but that can be a baseline as well. It's not perfect for diagnosis because I think a lot of women want that. It can help us if we've got suspicions of what's called primary ovarian insufficiency. So that's when a woman is going through a very early menopause. But when we're in perimenopause, which the vast majority of women, that's the trajectory, the hormones are so fluctuating and will be high one day, low the next, that the blood tests aren't as good at that. But I would use blood tests just to check other health factors like the thyroid. We'll do like a blood sugar test, just to make sure we're not missing anything else.
Yeah. I'm so pleased that we've discussed that one, because that's the thing that keeps, when I'm having conversations with ladies, that keeps coming up about the list of symptoms. Why do women experience menopause very differently to others? Again, like what I just said, someone will say, I'm definitely going through it because I tick this and this, and someone will go, well, I think I'm going through it, but I don't tick those same ones. So why do women experience menopause differently? What factors come into play with that? Is it just their own body, genetics, or is there lifestyle things that could affect that?
I think the answer is definitely both. So yeah, genetics will play a role to a certain extent, and women will also have different hormone sensitivities. You can put, well, women will often chat, I guess, about, oh, when I was on the pill, I felt like this, or I had this. There's so many exposures to hormones in our lifetime that we often have already had quite a number of experiences by the time we get into perimenopause. And then definitely lifestyle factors can make a big difference. I like to talk about like the pillars of health and longevity, and say, there's typically like 5 areas. So nutrition's really important, movement's really important, restorative sleep, your emotional well-being, and then medical support when needed is the 5th thing that's where we come in. But looking at those other areas and having that holistic approach, and not just looking at a woman in isolation of like the numbers and what, like drugs, it's actually the bigger picture that makes such a difference.
I'm so pleased you've said that, because a lot of people, I'm not saying I'm against Western medicine, but I wouldn't want to just jump to that personally myself. There would be other things, and a lot of people would class it as the boring things, but yeah, I would want to make sure that the boring things, the more natural things, are being looked at properly first, before going down that route. And it is something that I am constantly talking about within my line of business, going back to basics and eating like your great grandma would, rather than as much ultra processed foods as what people do. So I'm really pleased that you've said that, and because I know some people when they have been to see their GP, that obviously don't specialise it as much as what you do, it is the first go-to. And I'm kind of like waiting for them to say, oh, but they did ask me about my diet and how what my movement was like and stuff, and it just never comes, and it just automatically seems to be, right, well, if you're feeling down, let's get you on antidepressants and let's get you on HRT, or let's look at the and I'm like, there maybe is other things that we could look at first, but not being a doctor myself, and like I said, a lot of people don't want to hear the boring answer, because for some people, they want the results quicker, they want instant. And when we look at the more boring route of cleaning up our lifestyle as naturally as we can, it does take a little bit longer.
Yeah, it does. And you're right, like if we don't acknowledge all those other areas, we are doing that woman a disservice, really, because you're not going to get what you want from the medication. You can't neglect those other areas. And it is,
Yeah.
one thing I'm loving about the York Clinic is I get 45 minutes with my lady on a first appointment, and that's just such a brilliant opportunity to spend a lot of time looking at all of those different aspects, which is not a luxury that we have in the NHS. So that's it really does, yeah, make a big difference.
Yeah, huge difference, because when usually you would go to see the GP, you obviously is it about 11 minutes is the average?
Yeah,
Something like that. I mean, what can we do in that time? I mean, we couldn't even get this Zoom chat to work in that time. You know, like, I don't know how you can really get to know somebody and their lifestyle in that time. So 45 minutes is brilliant that you have that time for each individual. So our second category, we're moving into the exercise and fitness now. Obviously, with what I do, I wanted to be relevant to what I do as well. So what types of exercise becomes most important during menopause? I've written down strength, cardio, mobility, or would you just say all three, a mix, or is there one in particular that you would encourage during the menopause?
I think it's finding a balance. I always think you might have all your life not had a great relationship with exercise, and then you can still find something you love, and that's what's important. It's You're not going to keep doing it unless you feel comfortable and confident. So getting support, if it's not something that comes naturally to you, is a really good idea. Someone that can walk you through it. Strength is ever more important. So women will lose their muscle mass and bone density as they're going, from 40s onwards with those with muscle mass, and then certainly as our hormones shift, our bone strength really starts to deteriorate, and we're much more likely, sadly, to have a nasty fracture in later life. And as a population, we're all living longer, and yeah, it's hard because I see so many. I look after, I'm being a GP, I'm looking after babies right through to the elderly, and women do tend to live longer but in poorer health compared to men, and when they've done the studies, and osteoporosis is a leading reason for that. So coming back to exercise, yes, strength training we know will help with the our muscle strength, our bone density. It is also important to look at other areas. So flexibility. So I always, you might not have ever done it before, but potentially doing some stretching, some yoga, something that you find you enjoy, can be really important. And yeah, cardio, but it doesn't have to be high intensity training. That can have a role, but it's doing too much of that is a bit of a pitfall I see some of my patients falling into, and that can just put too much stress on your body, because when you are going through your perimenopause and menopause, you tend to sit with more fluctuating cortisol levels, the stress hormone, and hit exercise will also drive that higher. So it's finding the right balance and just recognizing how you're feeling yourself. Like, yeah, you can have variation in your energy levels, in a week or in a month, most definitely. So reflecting that in what the exercises you choose to do is really important.
Yeah, so the way that we do it on the on my online program, in the perimenopause section, the ladies have a huge variety of different options. And I do say to them, ideally, we want to be keeping that strength up. So ideally, if you've got the energy and you feel like you've got the strength that day or that week, we want to be aiming for about 3 strength workouts a week. Between that time, just take it day by day and kind of go with what, like a little self check-in on a morning. Do I feel like I've got the energy to be doing a full body cardio workout today? No, I don't. I really feel like I just want to do some yoga or some Pilates, and taking it more day by day. And then with the ladies that we know that are in the menopause, again, I really try and recommend them sticking with the at least 3 strength workouts a week. And then a lot of them, if they've spent their life really enjoying the HIIT workouts, they don't really want to step away from them. But like you've just said, obviously that can increase our cortisol. And if we're trying to bring that down, they then have the options to do like a lighter option of a cardio workout. But a lot of them do really struggle with that because they're just so used to doing that style. So they like, I suppose, how they feel at the end of the workout. And I get it, but yeah, it's just tricky, isn't it, with the cortisol?
I think it's just finding the right balance. I think for me, it's going to change, and you just got to reflect that back. And as you're going through these stages, you might find that actually, when you take out the for some women, the roller coaster of the perimenopause part, and things do start to stabilize, that you feel like you've got more confidence in doing a more kind of like an exercise pattern with more HIIT. It's just varying
Yes.
to where you're at, and responding to how your body feels.
Yeah, and I think as well, one thing, because like you just said, it can be such a roller coaster with the hormones, just not being hard on themselves when they are having those days where they maybe plan to do a certain style of exercise and wake up and they just feel flat and they don't feel like they've got the energy. Just kind of just again checking in, doing that self-check-in and saying, that's just not where I'm at today. And that's okay, because I might feel differently tomorrow or next week, but not beating themselves up over it, because I think that has such a negative effect on the mental health.
Yes, absolutely. Yeah, it does. Like, exercise can be so good for your mental health, but if you're too hard on yourself, it can have the opposite effect.
The negative effect, yeah. Why do women feel like their usual workouts stop working during menopause? Is this down to the shift in our hormones? Like we said, the cortisol hormone rising because we're doing the same thing and it just doesn't suit our body then?
I think that's very much the case, that we have got the shifts in the hormones. So it is more commonplace that you will sit with the higher cortisol levels, and weight gain can be a really troublesome thing during the perimenopause menopause period. And I think sometimes that makes women think, right, I need to go harder at this, and that's actually not the right balance. It's actually having a look at the bigger picture and trying to, because often we might also be not sleeping as well, feeling that we are potentially using nutrition, that can slide a little bit if we're feeling rubbish. So the other areas can start to slide, and then we can sometimes try and overcompensate with more exercise. It's difficult. There's often a lot to unpick.
A lot when it comes to the exercise and nutrition side. I do feel like again, it's not a one shoe fits all, and not even for that person's body or genetics, but their lifestyle, normal everyday, and even just mental health, how they're feeling and stuff like that. But yeah, I think that's one of the biggest things, the most thing that we discuss privately or on our boot camp. It's women really struggling with the weight during menopause, and that's the question. Why is the workouts that I used to do not working for my body anymore? But like you said, there's so many different factors. What's the biggest fitness mistake when in midlife that women are making?
I think it is, like we've spoken about, Verity, it's neglecting strength, like not looking at that, and trying to focus on making strength training a part of a core part of exercise, and then also potentially not having that balance with looking at some stretching, some yoga type exercise, and finding the right balance with more intensive cardio workouts, either less frequently or just what suits you. Having that time of being like, right, I'm having a bad few weeks, so that's the one that's going to slide, but I'm still doing these other areas, so I'm doing myself a lot of favors with these other bits of exercise I'm managing. Even if it is a
Yeah.
big walk that day, like you've just got, you tend, what, I know we're not meant to, I think the step count has gone out the window a little bit, but having some kind of goal of like, right, I've done a good dog walk today, or I've managed to fit that in my lunch break, or however it looks.
This is the thing that I say to the girls all the time: something is better than nothing, and that something can look different every single day if it needs to be, and that's okay. But I think again, I'm glad that you've mentioned strength, because again, it's a conversation we have a lot, where a lot of women are moving into the perimenopause, they're seeing the body change, and they automatically jump to, well, I need to do more cardio, I need to be doing more sweaty HIIT workouts, when actually later on down the line that could be a negative for them because they've lost more muscle and bone density.
Yeah, and we
So
know that muscle drives metabolism. So if we are actually then as harder as it gets, but if we're able to kind of maintain or build some muscle, that will then help shift our metabolism in a more favorable direction. So it can help with weight management as well.
the more muscle we've got, even at resting, we're burning more calories.
Yes.
Yeah. Moving on to food and nutrition, how should women change the way they eat during menopause? Do you advise women to change the way they eat, or do what works, what has been working throughout, or is there certain things that you would change?
I think it might be worth having. It's certainly an area to have a look at. We're all different and we've all got different like palettes and go-tos and lifestyles, and it can be hard sometimes to, cook from scratch. But there certainly is, as we've touched on, a lot more evidence to show that ultra processed foods are doing us probably a lot of harm. So that's one of my areas I try and have a little look at and speak about with people. So trying to reduce the amount of ultra processed food we have, and focusing on protein can be really important because, as we've touched on, we're trying to look at our muscle and bone health, and having more protein in our diet can really help to keep us fuller for longer, regulate our blood glucose levels, and yeah, be a brilliant starting point. Protein isn't something that's naturally that easy, I think, to build into your diet. So it is useful to have a little look. There's brilliant wealth of nutritionists out there, or people that have recipe suggestions, and doing some meal prep can be really helpful so that you can build that into your week. Calcium is really important as well. Sorry.
No.
Yeah, so calcium's your building blocks for your bone health, and we often don't get enough calcium in our diet. There is something called the Edinburgh Calcium Calculator, so that if you type that into Google, it will come up straight away. And I know that for the vast majority of people that fill that out, men and women, were often under, getting under the requirement of calcium we need each day. I think it's much more commonplace for a lot of people to be taking vitamin D supplements, which is brilliant. But I often say just make sure you might actually need some vitamin D plus calcium so that your bone health, you can be doing all that fantastic work with strength training. But if you haven't got your building blocks in your diet with those aspects, you're not going to be doing all the help you can for your bone health in the future.
Yeah, we use MyFitnessPal app a lot of the time for girls when they're tracking what they're eating. And one of the things that always flags up as well, sometimes it's as little as a couple of grams, is fibre.
Yeah.
A lot of people really struggle to get their fibre in. Carbs are always the highest thing. And I always go back to when people in the past have done the fad diets or even done things like the Slimming World and that sort of stuff, a lot of them are very carb heavy. So then when it comes to them trying to increase things like the protein, it's something that a lot of women really struggle with. And as well, fats, a lot of women are obviously very scared of good fats. They're really worried about even eating like half an avocado and things like that, or like the nuts and seeds and stuff. So it's really tricky because I know we're kind of like programmed from such a young age with some of these diets. But then
low fat things everywhere, wasn't it? So it's got quite that's like a healthy thing to be low fat everywhere.
Yeah. So it's hard because it's reprogramming after a long period of someone's life. But that's really good. Have a look at this one. So are there any specific foods in general? I know we've mentioned that we definitely need to be increasing or trying to focus as we can on the protein. But when it comes to symptoms like bloating, energy, hot flushes, is there anything we can actually eat that can change these things?
I certainly didn't touch on fibre, and you did, so thank you, Verity. So fibre is really important from the bloating side of things. We do start to see women typically, because of the estrogen receptors in the bowel, that your digestion can change, and women seem to be a little bit more prone to a diagnosis of irritable bowel and more constipation dominant. So you can have it going both ways, diarrhea or constipation. So finding a bit of a balance with good fibre intake is really important. With hot flushes, it's a little bit more difficult. So certainly we do know that areas of the world where they do eat a lot more soy in their diet, they don't tend to suffer with hot flushes to the same extent that we do. But then maybe factors, like they may also be eating a lot more whole foods, less ultra processed, less sugar. So I think it's really trying to look at the whole plate. And yeah, you can certainly look at soy as being something that you incorporate into your diet, but it probably would be pretty hard to eat enough soy because it gets broken down into phytoestrogens to really rectify hot flushes. It's more, I think, the of every other aspect of what you're doing, and
so like a collective rather than the one thing.
Yeah.
What are the most common nutrient deficiencies you see in menopausal women?
So certainly that going back to calcium's the leading one.
That's the biggest one.
And vitamin D deficiency is pretty common actually. Like we don't, it's not tested as widely because the blood test can be somewhat unreliable, but certainly in this country throughout the year we don't get enough sunlight to make enough vitamin D. So the guidelines are just take vitamin D supplements year round, like a daily dose so that you can keep that vitamin D level nicely where it should be.
What and how much recommended is it per day with the vitamin D?
So 400 international units is the recommended amount. And if you're deficient at any point, we can go higher than that to supplement. And it is worth looking at the supplements that have the, my brain's gone blank if it's K3 or K2, because that can help with the absorption of vitamin D. I can't,
yeah.
One's a mountain and one's not, but that's my brain today.
The next subject I've got is actually on supplements. And there is a lot on social media when it comes to supplements. And I think it's really hard because they do kind of like zone in on when women are vulnerable. So when they're overweight, they'll zone in on you need this, and this. And I think it's the same as well with menopause. I love that menopause is being spoken about so much more on social media, but then there's a lot of misinformation, like we said before we started this, and also a lot of things thrown. You need to buy this. And I have so many women that will spend hundreds a month on supplements. My believer is I'm more, like we've already said, more down the natural route. So I would try and focus on getting what you need from foods beforehand. If there was obviously a deficiency, then yes, supplement it. But a lot of people I found over the years will have quite a poor diet, not really focusing on the sleep, drinking alcohol, not drinking enough water, but then throwing hundreds of pounds at supplements. We can obviously counteract the poor lifestyle with a supplement. They're not magic, are they? But which supplements actually have evidence behind them to support menopause?
That's
Would it?
good question. So the two that I promote more than any of the others are sorry, I just got a Zoom message coming up. So magnesium glycinate specifically, because that one's easier on the gut and it can help with sleep and mood stabilization. And that's one that it's hard. There isn't lots of research and studies specifically around these supplements, but that's an area that is always emerging. And I think magnesium does seem to be more promising when we're starting to look in those areas. And the other one is actually creatine. So when we're looking at the studies for that is actually looking really promising and actually got some evidence. There's a big supplement that just doesn't, and I'm sorry because this one gets really people do spend a lot of money on this, but that's collagen. So I know
You were going to say that.
it does just tend to, we can't breaking it down with the science, it will just get broken down into amino acids. So it's not any different than, eating some like a portion of protein or meat that will get broken down into that. So yeah, that's the one that I would say maybe save your money in that area and look at those others.
And with the creatine, the monohydrate creatine.
Yeah, I think that's that's felt to be the better of the type.
Yeah, those are the two that I was going to say. You're going to ask if you were going to recommend. I've got that written down. But yes, collagen is one that, again, I know a lot of my clients spend a lot of money on, and there's very conflicting things when you read about this. So I'm very pleased that you have said that, because I know there's been quite a big argument at the moment with somebody who promotes it and actually makes it, Davina Taylor. Yeah. So there's been a lot over the weekend online about that, and I know a lot of my girls use that. So right, I want to move on to HRT. So who is HRT most beneficial for? Who would be a good candidate for it? Because a lot of the time it could be the second you show symptoms, everyone should be on it. But then again, there's conflicting things.
Yeah, it's really hard to say exactly, because I'd say it does need like an individualized approach, and it needs to be tailored to that woman because we've all got such different things going on. There is more evidence to show that it can be beneficial started in perimenopause. So like you're not to worry about starting it sooner rather than later. I think women were meant to feel that they had to wait until their symptoms were really severe. They had to be really in the thick of it before they would be starting the HRT, but that's not necessarily the case at all. And I think that came around the worry of women. There was a study done 20, 30 years ago, and it was around breast cancer risk. And that study has since been really, just pulled apart. It wasn't a very effective study. It looked at giving equine estrogen, so a horse type of estrogen, and it had a larger proportion of smokers and overweight patients in the 60s. So it wasn't a very useful study, but it really put the fear around HRT into the medical profession and into women. And there's still a hangover of that to this day. So I think clinicians are reluctant to prescribe it to women who had that bit earlier in their perimenopause journey, but we've got emerging research to say that that can be a good thing. I do find sometimes when we start it in perimenopause, it doesn't suit a woman as well, and that's because she's in that roller coaster. And which, when we're trying to stabilize it, she might have it at a point where things are a bit better and she doesn't get any added benefit. So it's difficult to say. It can be a case of trying it just to see how you go and then revisiting it in the future if it doesn't suit you at that point.
It's a bit of a trial and error thing, and again, very, very individual. It's not a one
size
answer will fit everybody. Can you do menopause without HRT? Do you have clients who?
Absolutely, yeah. I think, and for some women, I haven't even said that. For some women, HRT isn't the right option. She may have a very, very strong history of breast cancer, or having had breast cancer, or other types of cancers that can be driven by hormones. So it's not always an option, a good option, really, a safer option for every woman. So there's certainly are other options out there and other medications that we can try. There are some symptoms that are more predominant. There are things we can do, and again, just looking at those other areas that we've been mentioning. So looking at the other aspects in life that can help that holistic approach.
Yeah, I know that's one thing. Again, when I have been speaking to women, a lot of them will say, "I don't want to go on it, but I can feel the times coming," and I think they maybe feel like they're going to be forced to be on it, or that's the only option. So I think it's nice for people to know that they could get through the menopause and not use it, because they could make other changes, like you said, more holistically. One of the other things that's talked about a lot with menopause is mental health. So why can menopause affect mood, anxiety, motivation, and brain fog so strongly? Is it the hormones, the shift in our hormones?
Yeah, so we know all three hormones really can play a role here. So certainly estrogen, progesterone, and testosterone can impact like the neurotransmitters and make us feel at odds with ourselves. And brain fog, I think, is such a common symptom. It's near on one of the more common ones that I will see a woman mentioning that's becoming, and quite distressing, because it's, we can laugh about it, but sometimes when you are, in a work situation and you're forgetting a really simple word, it then drives anxiety, and they all link into one another. So they can, certainly drive one another. And I don't think it's fascinating, isn't it? Because as is the way with women's health, we don't have copious amounts of research, so it's an emerging area, but we certainly do see improvement when we are using hormone replacement therapy, in particular, at cutting through, a lot of that's those symptoms. And certainly, mood can be, women can just describe like blind rage and feeling just so frustrated out of nowhere, that real kind of sudden overwhelm of feelings, and that certainly can be helped.
Yeah, with going back to the brain fog as well, I know a lot of ladies that I've spoken to, especially like in a setting like what you just said, when they're at work and there's that word and they cannot think of what that word is, or they've put something somewhere and someone's asking them for it at the work and the pressure's on, and they get really, really embarrassed. But going back to the creatine as well, I've read some research that the creatine can actually help with the brain fog.
Yeah, that's right. Yeah, so that's the research that is sort of looking, when we look at it, what we call like statistically significant. So it really is looking like that's a good option to try, and certainly can be helpful in that area.
Yeah, definitely something that I think women need to, even if they just have a little experiment with themselves and just see if it's right for them. Moving on to sleep. Why does sleep become, this is one of the massive things. I cannot sleep, and a lot of women wake up several times throughout the night. But why does sleep become so disrupted during menopause?
So again, that seems to be quite hormonally driven, that we, are like, it's kind of a term like a type of insomnia that can happen in menopause. And it's probably, not linked into lots of other hormonal processes in our body, because sleep usually like interacts with cortisol and like melatonin and lots of other hormones, that processes that go in our body. So when we're in our perimenopause, it's how things start to shift and change. Other things that can be not looked into as well, from my point of view, are women can start to suffer more with their waterwork, so simple like bladder symptoms. So it can be that they're, all of a sudden quite awake and thinking, oh, do I need to wee? And then, having these toilet trips in the night, and then you're wide awake once you've gone to the toilet. And that's a canary I'm really passionate about, because that's a really simple thing to treat and make better. So that's something I will bring into every consultation, is asking around sleep and needing to toilet.
Because it has such a knock-on effect for the rest of the day, the following day, sorry. Even when it comes to obviously doing a workout, if we're tired, do we feel like doing it? No, because motivation's super low. Even with the types of food that we then want to choose, and even if we've maybe planned the day, we've got high protein, high fats, really balanced, healthy food planned, when we're tired, we don't feel like eating that, and we do want the carbs. And then women are struggling. It's such a knock-on effect, I found, with the sleep, because then that's when a lot of the time women are really struggling with their weight and see the difference in the change in their body. But can the magnesium glycate help with the sleep, the quality of sleep that someone's getting during the menopause?
Certainly a supplement that's worth trying, and it can help with it can help get a more restorative sleep. So that's a supplement that's worth adding in at bedtime.
Perfect.
Yeah.
The next question is about testing and medical support in general. And this is one thing that I feel like I've had a conversation quite a lot about, but very, very different. And some women will say, I've been to my GP and they've done a blood test and said that I am definitely perimenopausal or definitely menopausal. And then I've heard some other ladies say that they've been to their GP and had testing, and they've said, well, my GP said that there isn't a test that I can actually find this out. Is this a thing? Is there actually a test to find out? Is there a certain time that we should do the test, if there is?
So there is a blood test that we can use in certain circumstances. So there's something called the FSH, which stands for your follicle stimulating hormone, and that is raised when we're in menopause. So when we've reached our final period, that hormone will sit a lot higher, because it's a hormone that's sent from the brain to the ovaries. It will start to become a bit more erratic in perimenopause, but it can be so fluctuant. So that's the time when your periods and your cycles might be changing. They might be becoming shorter, closer together, or even further apart. And that's when that hormone can look normal one day and then abnormal the next day. We use that hormone really to guide if a woman's going through a really early menopause, or if we're wondering about contraception, if that's in the mix, because sometimes we haven't got cycles to go on because that woman's maybe got a coil or on a progesterone, on a pill of some type that's stopping her from having any bleeding. So that hormone can then be useful in certain circumstances, just to check what's going on, to guide that woman to know what to do. The other reasons I would check hormones are when we are using treatments, so be it testosterone or estrogen in particular. Sometimes will still be quite symptomatic, and I will check hormone levels just to see, monitoring or absorption, and check we're doing okay.
Okay, perfect. So I think we'll go to our questions now, where these are questions that women like, the questions that most women want to know. So they're off a little bit of some of the things that I've got, and then we've got some quick fire ones. So the questions most women want to know, when I've been discussing that we were going to have this chat, is HRT safe? I mean, we've already covered this a little bit in there, but it was just straight to the point. Is it safe? Like a yes or no?
I think yes. For if we've individually assessed you, and for the most of the population, HRT is actually safe. We're using much safer products than we ever used to. So body identical estrogen, progesterone, and testosterone, and there is a lot more evidence and safety to back it up.
But before you would prescribe somebody with HRT, you would look at it from a very personal point of view and look at other things beforehand as well. Which supplements are worth it? We've already discussed this. I think we've already said the two main ones for you: magnesium and creatine.
Don't forget your calcium and vitamin D.
Calcium and D, yes. Why am I exhausted all the time, doctor?
Yeah, so definitely exhaustion can be there. And I think that's that mixture of probably, poor sleep, the hormone levels just crashing and making you feel like you haven't got that energy anymore, and then often sitting with that higher stress hormone level, so your body's just feeling fatigued, achy as well. So many women start to present with that, just feeling like they've done a full body workout when they actually haven't.
Yeah. So again, going back to the basics, just having a look at your lifestyle as it is right now and not comparing it to what you were doing when you were 18 and thinking, actually, I need to change some things because this just isn't suiting my body now. Even the way that we eat, I know a lot of people will say, because I go on about ultra processed foods all the time, and a lot of people say, well, I've been eating this certain ultra processed food all my life and it's never done me any harm. But it's not the same from when we were eating it when we were children, because obviously the ingredients have changed so much. So again, even if there is certain ultra processed foods that you want to keep in, maybe cutting back on them, or maybe finding a healthier alternative to it, and just, again, like we keep saying, looking at the boring stuff to try and boost those energy levels. What can I realistically do to feel better, if there was a one answer for that?
I think to feel better, it probably is worth, having a chat with somebody that, be it somebody like Verity or myself, to get some ideas on what you could improve, because it's really hard when you're in the thick of it to have that overview and figure out where you could change things, where things could improve. Also just talking about it full stop, actually. I think it's brilliant that it has become a much more talked about thing. There is still a taboo around it, and some women don't feel comfortable, but I'm glad the conversation is happening more readily. I think that makes all the difference.
100%. And I think there is something really, really special about women in general coming together when women support each other. I know it's a meme or a quote that gets thrown around, that when women support each other, incredible things happen. But I do genuinely, hand on heart, believe that. And that's one of the reasons why I only train women, because there's something really special about us all being on that journey together. But I think when it comes to the menopause, like you just said, I absolutely love that it is something that is more talked about. But like we've said, there is also a lot of misinformation. And I personally as well find that it can be quite negative, and a lot of women dread, noticing any signs of the menopause coming and thinking of it as such a negative part of their life, when actually, why can't we flip that and women come together and talk about it in such a positive way? And it's exciting that we're going through this next phase of our life. And I think going into the different stages of our life, when we have a different attitude and mindset towards it, it makes us go through it in such a different way. So I think, yeah, if you want to feel better, mainly mentally, come together as women and speak about it and try and find the gratitudes and the positives from that situation. I think a lot of people maybe would have a conversation with the husband at home and tell the husband how they're feeling, but they won't ever get it. And I love that, some women are in a position where they can do that, but and yes, still have those conversations, but men, I don't think will ever get it.
Yeah, I think it's really important that men are aware of it and do, become clued up about it. It's going to affect them indirectly.
Yeah.
but yeah, I agree. I think women coming together is a really powerful thing. Absolutely.
Yeah.
And reframing it, yeah, so important. I really do love that. We're going to spend potentially about a third of our life in what's called like post-menopause, and actually looking at it as like, yeah, look, this is a new chapter. I'm going to bring a different self to this. I'm going to be actually not plagued by a monthly, potentially,
Yeah.
monthly bleed that catches me off guard, and this could actually be a nice thing going forward.
Yeah, absolutely. I agree. I think we really need to try and change the view on it and get rid of this negative, like, oh, the menopause, like, wow, you're going through the menopause too. Like, yeah, sticking together. What can I realistically do to feel better? That's something that someone else has asked, but I think we've covered that right the way through. Going back to the basics, like we just said then, speaking, not hiding those emotions and trying to find the gratitudes in the situation. Can I get through the menopause without the HRT? Again, we've already covered that. You've said you absolutely can, but again, we need to look at our lifestyle as a general. Will I get my sex drive back? Was one of them.
So yeah, that's really, again, something I will ask every woman about, so she's got the opportunity, because that's again something that doesn't come naturally to want to talk about, but it is really important. And what I would say is, yeah, if that's bothering you, if you're finding your sex drive is lower and it's impacting you, because the flip side is I have women who come to me and they're like, I'm okay with it, but my husband's not. And that's like a different situation to explore, really. So if that woman's suffering, then certainly there's a lot to talk about. And there's some real basics there. So when we go through menopause, the shift in hormones, the area of our body that is impacted the most is the pelvic area. So it's our pelvic floor, vulva, vagina, and bladder. They've got the highest need for estrogen of everywhere in the body. And this is never spoken about, but our actual like labia and clitoris will shrink after menopause. So there are things we can do to help that. There's really safe to use a vulva vaginal moisturizer, and also for nearly every woman, we can use some topical estrogen cream that can help to kind of restore the tissues, so to keep them kind of thickened, to keep the collagen, the blood flow, the nerve endings working as they should. Because if you imagine you've got something that is becoming more thinned, and less robustness to the tissues, everything does start to become more uncomfortable. We sit being more prone to infections. And yeah, the sex drive then will like fall off a cliff if things feel uncomfortable down below. So that's a part of the picture as well.
Absolutely. And I'm so pleased you've said that, because yes, we hear about the change in the sex drive, but not actually like with the things you just said, with the change of the clitoris and everything. So that's really, really interesting to add in. And you've just already mentioned the pelvic floor, but that's one of the things, again, that's been asked. Does the pelvic floor get weaker during menopause? Because a lot of women notice, like you said earlier, the change in waking up more frequently through the night to need to go to the toilet. And obviously we have things on the market like the tenor ladies and stuff like that. A lot of ladies will say that they put it down to just age and always put it down to childbirth. When actually there is ladies that have never been pregnant, and then later on in life they're finding that their pelvic floor is weaker. So is that due to the menopause?
Yeah, so again, it's been given the term now, so this is a mouthful, but genitourinary syndrome of menopause, or GSM for short. And the GSM is the fact that estrogen level falling changes how everything sits in the pelvic area. So our pelvic floor loses some of its robustness, it loses its collagen and ability to hold as well. And certainly I have women who are starting to suffer more with like stress or urge incontinence. So, going for a run, and all of a sudden, it really been quite different to how it used to be, or coughing, sneezing, or even just getting home and the minute you put your hand on the door knowing you need the loo, it all triggers it. And using the a good, well, firstly, I never underestimate how good seeing a women's health physiotherapist can be. I always I've got some great colleagues that work in that area, and I always highly recommend doing that, because we're all different. And one thing I find in a lot of ladies when I examine them is they've actually become what's called hypertonic. So they're holding their pelvic floor, because of this all happening, they're holding their pelvic floor too tight, and then it's just getting exhausted and we're having incontinence. So yeah, what I was speaking about before with like moisturizers and estrogen, that's an important part of the picture, but also potentially getting a review done with a women's health physiotherapist is worth its weight in gold.
I had a prolapse after I had my first baby, and I can't say it, but the thing that you said, where you're basically overworking the pelvic floor,
Yeah.
that's what happened to me. And I was so conscious after having my first baby of making sure that my pelvic floor stayed strong so that I could get back to exercise and repair my core and everything. I overworked it.
Yeah.
And I ended up having a little prolapse, like a few months down, like postpartum. And I'd never heard of that. So yes, I know that's a thing. And to be honest, I'd not thought of that when ladies are speaking about the pelvic floor getting weaker. they've maybe got that in the back of the mind. Then when someone mentions menopause and they know that the pelvic floor is going to get weaker, they could overtrain it.
Yeah, it can happen, and it's subtle, but and then women sometimes will present to me with lower back pain, tummy pain, and it's actually related to pelvic floor. So the pelvic floor is a really important area that does also need a check over and a good assessment.
But massively gets neglected.
Absolutely, it does. It should.
Like, I have this conversation all the time with ladies, and it is the one area they'll train the legs, they'll train the biceps, they'll want to have a nice back and everything, but the pelvic floor, they forget about that muscle, and then it's completely neglected. But then when they're saying things like, "Oh, I can't go on the trampoline with my child, and I can't go anywhere where," someone said they wanted to go to a comedy show, they were like, "Oh, I could never go because I'd end up weeing myself when I was there." And like, they're missing out on opportunities and occasions but they look fantastic and you can see the muscle that they're carrying, but then they're not looking after the pelvic floor, which is just a muscle that we need to also look after, but not overdo, like me. So our quick fire questions to end. The same again with the weight loss, like meal replacement diets or like fad diets, fasting, that sort of thing. Is anything like that ever recommended during menopause, or again, like we said earlier on, just trying to stick to the basics?
Yeah, it's hard. Some women will swear by certain diets, and that's the only thing that works for them. And you've got to individualize your advice. But I would say caution in too much fasting. Fasting can be there, but not probably as extreme as it might, as it can be. A slight variation in your daytime routine where you do have a bit of a fast can be helpful, but not going too far with it. And yeah, I think it just has to be tailored to that woman. I think fad diets are there to overwhelm us. It's again all that noise, isn't it? And your menopausal, try this. So yeah, finding kind of some good solid advice and trying to stick to something that you can keep up, because fad diets are often targeted at kind of short period, and we lose that weight and then we regain it when we sort of try and re-enter a more normal pattern to our eating.
If you're going to go down that route, you need to be looking at it. Could I do this for the full year? For instance, let's take it year by year. Could I do this for a full year through occasions, through holidays? If you can only last a couple of weeks, then it's not the one for us. It needs to be maintainable. Most overrated menopause advice?
Oh, that's a really good question. I think
There's so many though.
good. I think it is, yeah, just it almost gets quite overwhelming. Like you say, you just have to have had a conversation near your mobile phone, don't you, about menopause, and you are inundated with adverts. And I think that, yeah, there's a lot of pressure to be overdoing it on supplements, potentially as well. Having, yeah, the testing becomes a thing, it's like there's a lot more labs that are setting up trying to convince you that you need lots of testing to be done. So I think it's just breaking through the noise and trying to find good advice is the hardest thing.
Yes. We have already talked about this, but if you had to pick one, the one supplement that you highly rate?
Oh, I think I've like this more personal, because I think we're all different in how we might respond to supplements.
Yeah.
I guess my non-negotiables, which we've spoken about already, are magnesium and creatine, but I've only recently started taking creatine and finding that's working really well for me. So that's just something like more personal. I think you've just got to try them and see how you it makes your body feel.
Yes. One daily habit every menopausal woman should prioritize?
I think this would be just as simple as yourself. So having some point in your day where you just think, like, yeah, away from all the modern technology and distractions, just to kind of calm your mind down is probably one of the best things you could do for yourself, because it is, modern life is so intense and you are probably sitting with a lot of stress and you're not realizing it. So trying to, yeah, calm you, like do something, whatever it is, even if it is 15 minutes, ideally, an hour would be fantastic, where you can just try and calm your mind, make yourself feel a little bit more, yeah, like yourself again.
Yeah, something solely for you, just to kind of, I suppose, like regulate your nervous system.
Yeah, absolutely. Yeah.
Even if it was, because a lot of girls will find that quite hard, especially if they have children still at home. Like, a lot of guilt can sit around that. And I've said to some of my ladies before, if there's someone at home to watch the kids when they're little, then even if it's just a 10-minute walk around the block, you know, getting fresh air and moving, but don't take your phone and just switch off, even for 10 minutes, can really help with the mind. Or a lot of my ladies will say, oh, I'm just going to have to go get a bath and just switch off for a minute. So something, again, it's a very personal thing, but something that makes you calm your nervous system down. And it is solely about you and nobody else.
Totally agree.
Best form of exercise during menopause, I think we've covered that. The main thing being strength training. Yeah. But whatever, again, makes you feel good and makes you feels right that day. Biggest nutrition mistake women make?
I think that is perhaps trying to do too much. You know, like I see women that are bouncing from one thing to another, you know, be it like go from like a calorie deficit to then try and like meal replacement. I think just try and not make it too complicated. Try and just scale it back and find something that, as we say, is achievable that you can do long term. And hope that will then, when you're looking at it, not in isolation, because I think that's it. Some people just will tackle one thing at a time. But like, right, my diet's the thing I'm going to change. But if you don't look at your other areas, you're probably not going to get the progress you'd like.
Yeah, I think that's the biggest thing with nutrition in general, no matter what stage of life you're in. A lot of people really overcomplicate it. Coffee, helpful or harmful?
I think so. Coffee is again quite individual. Some people react more to the caffeine like stimulant than others. And I think everything in moderation is probably the most important advice. So if you do love coffee and it's a non-negotiable, have it, but don't have too much of it.
Yes. Alcohol and menopause, what should women know?
So alcohol can, yeah, it can intensify your symptoms. So that's something to be mindful of. It can also be something people turn to when they're going through this time because it's a relaxant. It dampens down anxiety whilst you're drinking it, but then actually afterwards it can intensify anxiety and worsen sleep. So I sort of really do. There's so many brilliant alternatives available now, and I really do look at it and say, can you cut back? Could you have less? It's worth having a go because that can make such a big difference. Actually, cutting back or cutting alcohol out potentially for a while to see how different you can feel.
A lot of women will say that it helps them sleep, or like you said, they'll be feeling anxious, and then they'll have the glass of wine and feel like they can like calm themselves down. But then they have that peak, whether it's before they go to bed or later on that day in the morning, they're waking up with that anxious feeling. But again, I suppose it's like with coffee, you know, some people it really suits them. Like I can't drink coffee, it makes me feel really anxious. But I know some ladies who can have like 3-4 cups a day. Like it doesn't touch me. I can have a cup before I go to bed, sort of thing. But yeah, alcohol can obviously affect our hormones more.
Yeah, and physical.
One,
Sorry, I was going
sorry.
to say, we see that it affects the person's resting heart rate for up to 72 hours afterwards. So it's massive, isn't it? Just I think we know that you're not going to get as much deep, what we call it, the like REM sleep when you have a glass of alcohol. So you will have that next day knock-on effect, even if you probably, you know, even just with a small glass, it can do that. So I think it's just, I'm not saying everybody has to chop it out. I just think it's reframing.
Oh, I do.
Well, I stopped drinking from 2 years ago and I don't miss it. Like I think I've got a young family, life's busy enough without me having that like lag feeling. So yeah.
Yeah, the same. I stopped drinking, it's over 10 years now. So when girls are speaking to me and they're struggling with it, like you're saying, I'm not saying everybody should cut it out. I do. I'm like, just cut it out. You don't need it. Just cut it out. There's so many benefits when you don't. But I understand that some people do feel like they need it, especially in a social setting. One symptom that women are often shocked is linked to menopause.
Oh, that's a good question. I guess that I think I said it already, but like body odor changes is quite a shocking one. Or like, there's loads. Like also tinnitus, like that can start, and that not many people realize that. Or like dental problems are starting to have more issues with your teeth. That can be a menopause issue
Wow.
because we have drier mouths and we're more likely to get cavities and issues in that direction.
Right.
Sorry, that was good. Can't give you one on.
Yeah.
Now I'm always like,
That's right. We've done the last one again is on exercise. We've already covered that. So if every woman approaching menopause could start doing just 3 things today to improve their long-term health, what would it be? 3 things to improve their long-term health?
So I would definitely say like exercise should be a focus, particularly strength training is a really, really sort of solid place. Nutrition, I think is I hope this, I'm picking big subject areas, aren't I? But yeah, nutrition would be it. And I think number three is the hardest sometimes, but just, and it links into these two, but it's just prioritizing yourself and just thinking, right, this is a time in my life where if I don't do this, I'm probably not going to live in good health for as long as I possibly can, because it's really
Yeah.
the changes you make at this time in your life will set you up for the years to come.
Yeah. 100%, absolutely agree. Thank you so much.
It's my
I've really, really enjoyed that, and I really feel like my ladies will gain so much from that.
good.
We did go over the time, but I don't know how we could have done it any shorter. But thank you so much. I really, really appreciate that, Helen. And I can't wait to share this with my ladies.
Thank you. Lovely to meet you, and I hope that's helpful to everybody listening.
Yes, it will be. I know it will. Thank you so much, Helen.
Thank you.
Thank you. Bye.
Bye.